Okay. Hi, Sarah.
Hi, Rianti.
It's nice to meet you in person, even though via Zoom. We have been chatting like almost 3 months already, 3 to 4 months, if I'm not mistaken. Thank you for
Yeah, yeah.
spending, yeah, thank you for spending time with me today. Uh, we know that we have a very huge time difference.
Mm,
I am in Malaysia and you are in the UK, so we have
yep.
definitely have very huge time difference over here. But you're still able to make time for me, and I am very appreciated. All
Oh,
right,
bless
okay,
you. Sorry, I'm just sitting trying to get a comfortable position.
all right. Okay, the reason we are making this video actually to listen to Sarah feedback, or maybe we call it testimonial after she wearing Aulora Pants. With me here now is Sarah. Hi Sarah, I would like you to introduce yourself first.
Yeah. Yeah, my name's Sarah. I'm from the UK, near London. And yeah, do you want me to tell you more about the why I got the Allura pants, or or just yeah, I don't know what else to say about me. I have scoliosis. And yeah, that's why I bought the Allura pants, because I saw, all the testimonials and the photos, but also because I read about, I really like infrared therapy. It really helps my bones and joints. So I read a lot about the fibers and what they were made of, and I thought that makes complete sense. Like, I love, ceramics and heat, and it's like molding clay, like when you do
Yes.
therapy and massage on the body. So I just thought, it's just, to be honest, it's what I've been looking for already, actually, because I've been trying to look for like a suit to wear to help
Mm.
correct my, I think I told you, yeah, I was looking for like a cat suit that was made, and I thought of like I was thinking of like what material, to use. I was thinking like latex or something where you can like put straps in, around all the meridian lines to try and like push the curve straight. But yeah, I never thought of ceramics in clothes. I didn't know that they existed. You could make a fiber. It's so clever.
So our
Yeah.
Aulora Pants is a very new for you, if I'm not mistaken.
Yeah, very new. Yeah, I didn't know. I had no idea that they made fibers out of ceramics.
Okay, how did you get to know about Aulora Pants?
I found out through you it was on my scoliosis page, the Standing Up to Scoliosis, and you posted the photos of all the people with scoliosis wearing them. So I found out from
Yes.
you. Yeah.
Yeah. Thank you for reading my post, and I really, really appreciate it. And I am so lucky because you are the one who respond to me after I post. After I posted the information, and I
Mm.
from the beginning, actually, I am not really know that you are the admin for the group. I am really
Oh
scared.
yeah. Oh, I only started the group a year ago. Like, it's just
Yeah.
yeah.
Okay. After I share with you the information about Allura Pants with Kodenshi, why did you interested with the Allura Pants? Since you already mentioned before, you really impressed with the ceramic and the heat and also far infrared. Can you please help me to explain more about it?
Yeah. I'm qualified in physiotherapy, and we physios use infrared
Mm,
to help blood flow to get to the soft tissues for healing.
yes.
And obviously heat helps, relax the soft tissue as well if it's stiff. So it's getting moist fluid, and yeah, it's just a popular thing that's been used for therapy, for quite a long time. And yeah, I'm always using heat. I'm always going in like hot baths and jacuzzis and things like that. But obviously when you're in water, you don't get the support. You can't use your muscles, to
Yes.
support in the same way. So it has its own benefits, hydrotherapy. But yeah, I was looking for something because I wear a heated jacket already, an infrared jacket, and that helps the pain in my bones where my rods are. But yeah, I just thought that sounds that's yeah, I believed it would work, you know, because I know about infrared and yeah, ceramics. I've got like, I've even got hot stones, you know, ceramic made of ceramics, and they work really well. Like they really relax, you know, tension in the body, the ceramic material. Yeah.
All right. Do you mind to share a little bit about your health issue? You mentioned that you're having scoliosis. May I know, did you done any operation, any road incision? Maybe you can explain a little bit more details.
Yeah, I was diagnosed when I was 16, and the curve was already 55 degrees. So no one noticed it was happening, and I actually self-diagnosed. And they, you know, here in the UK, it was before the internet really, and we didn't know about any other therapies, alternative therapies. So the doctor, and also that's what the doctors do, you know, they do bracing and surgery. So they just told me that it could get worse really quick and my heart and lungs could be squashed. And there was like people just panicking around me. No, panic, you know, even though I felt fine, I was in no pain, I was doing well at school, I didn't even realize, you know,
Yeah.
it's quite scary. But so they just recommended surgery in 6 months time, and had the rods put in 6 months. It's quite a shock after being diagnosed. Yeah.
So you done the operation?
Yeah, my parents, they didn't know about anything else, you know, no one looked into anything else, and just I was told that's it, you know, you need the operation, you might die, you know, in 6 months.
Yes,
I was told my heart
exactly.
and lungs could be squashed in 6 months. Get it done ASAP while you're young, you know, better to do while you're young, you'll heal quicker. That was it, no other option.
May I know how many rod was inserted in um at your backbone?
Oh, I have 2 titanium ones, so they're like the Harrington style, like the original, with screws at the top and at the bottom of the thoracic spine. 2 titanium. Yeah, I think that's the most common one. I think that's the one most people have had. Yeah.
So the rod will be remain there for the rest of your life.
Yeah, that was the idea. That was what I thought would happen and presumed. But they have taken out 5 discs and fused the vertebrae. So the rods can actually come out, and the bones are fused, but they, for some reason, they putting the rods in is part of like it, because when they fuse the bones, if they don't put the rods in, it won't work as well. Do you know what I mean? The rods kind of seal the position that they fuse the bones in, and then your muscle and soft tissue adapts over the years. And so then if they take the rods out now, I'm adapted, you know, to the new position. So it should be okay. I've been told, yeah. Like, I know lots of people who've had them out because of problems. So I know that, yeah, they can come out. But if you want another surgery, another big operation.
I was wondering how much is the cost of the operation?
Oh my gosh, I had it done in private insurance. So I don't, was it £20,000? I think 20 to 30, maybe 30,000. I'm not sure. My parents told me, but I forgot. I just, whoosh, no. A lot
It
of
is
money,
equal to like 200,000 plus minus ringgit Malaysia. You can buy a house with that money.
Really? Yeah. Not here. Not
Here,
in
over here, yes, you can. Yes, over here,
okay.
yes, you
Oh
can
my
buy a
God,
house.
I'd much rather have a house than the rods. Give me the house, take the rods. Jesus Christ.
Okay. What do you feel after the surgery? Do you still have pain right now? And that makes you bought the Aulora Pants?
Yeah, I have loads of pain. I have arthritis, and where all the rods are. and I have a disc problem above the rods, and I have really bad pain at the bottom of the rod where the screw is. So people, that's common to get pain above and below, you know, problems, and arthritis because they've fused the bone. There's no movement, and it's 20 years now they've been in. So yeah, I personally woke up with chronic pain when I was 22, 6 years after the surgery, when my bones stopped growing. So that was the age where everything seemed to fix. And for some reason, although I was dancing professionally, I was exercising loads, I was keeping, you know, loads of mobility, something just got stuck. And I did have an ankle injury, actually. I sprained my ankle when I was dancing, so maybe that was part of the reason why maybe the structure collapsed a bit and it didn't heal right. I don't know, but a friend of mine thinks that it could be because my bones stopped growing, that's why I got in pain. But who knows? I haven't spoke to enough other people to find out when they got in pain. But it is common to have pain after surgery. So some people say their pain is better, you know, they have loads of pain before and then it's a lot better. But most people then years after are saying that they're in constant pain still. So scoliosis, you get pain with scoliosis, and the surgery, you know, the operation doesn't correct the scoliosis fully. So there's still part of the curve there, you know, in my lower back as well. And yeah, pain is the big thing with scoliosis.
Yeah, I do understand, because even though I personally I don't have any scoliosis problem, I do have back pain. And
Okay, yeah.
and Aulora Pants helps me a lot. So I also want to know, what is the health improvement that you are having after you wore the Aulora Pants?
So straight away, I had some relief of I had lower back pain, and that went away straight away. It wasn't like really severe lower back pain, because most of my pain is where the rods are. But yeah, that was amazing that I just put them on and straight away it was like this warmth and support from the bottom, and it enabled my muscles to like untangle a bit and sort it out, the pain. Yeah. Do you ask about just pain, did you?
Yeah.
Yeah, so yeah, that's
yeah.
I think it's probably helped a little bit with the pain at the bottom, where the screw is at the bottom as well. It sort of supported it and lifted up a bit. So yeah, I would say it's helped with my pain more from there, lower waist down, you know, the pain there. Yeah, and that's probably where the pain is the worst anyway, in the back, isn't it? Like
yeah, because not everyone know how this pants is work, because actually when the pants is touch your skin, it will absorb the our body temperature, and at the same time it will release the far infrared rays back to the body. So that is why you feel warm like over there, and you can feel the pain is like reducing gradually. Am I right?
yeah, definitely. Yeah,
Yeah.
that's what
Yeah. Okay. So beside the pain that you're having, what other else that you want to correct in your scoliosis?
Yeah, I have a curve in my lower back still. So I guess I was hoping to get improvements with that, because I think when I was born breech, my bowels got a little bit twisted, you know, and the liver, I had a jaundice, and I feel soft tissue tension, you know, and pain and twisting lower down. So I was hoping that they would help with my digestion as well, and my bowels, which it has. Yeah, it's definitely supported them and freed that up a bit. And I have to do a lot of work on my liver area. That's where I have the most tension still, you know, a lot of massage and soft tissue, because that's really, really tight. But yeah, it helps everything around the pelvis, the soft tissue around there. And yeah, that in turn kind of supports the shoulders better then, when my hips, you know, and my pelvis feels like more supported and relaxed, and this, you know, then I feel like my shoulders are as well. So yeah, it does radiate up as well. But yeah, because I've got rods in, I don't really know the full effect of how it could help me, unfortunately. I wish I can imagine that it would push the whole curve, that I've got an S shape. I can imagine that they would sit and that it would push the whole thing, and it would, you know, your body would adjust and ripple, and it would reduce the curve, definitely. But I can't, my curve can't reduce anymore.
Yeah,
But
do you mind?
definitely,
Yeah,
sorry.
do you mind to share how, I mean, how frequent did you wear the Aulora pants? Is it like 24 hours or maybe only 8 hours per day? Do you mind to share? So you have the
I wear them all day, but in the night time when I'm relaxing, I get uncomfortable because they're quite tight, so I take them off at night, you know. But yeah, I wear them all day.
oh
But only when I'm really like doing a lot and going out, because I'm quite sick of them, you know. I have a lot of problem with the rods at the moment, so I'm not really going out a lot, so I'm not wearing them every day. So I have you know, I haven't actually worn them that much since I've got them as I could be, but I feel better. I only feel I get benefit when I'm active, when I'm walking around wearing them. If I'm lying down, they just feel
yes.
tight. I don't get anything out of them, if that makes sense. Well, it's not that I don't get anything out of them. So the heat, you know, can help lying down. But yeah, definitely, I think that they absorb more heat from your body, don't they, when you're walking around, and then they do a lot more when you're active. So I like exercising in them and doing yoga especially, and yeah. And walking. I think they actually seem to work best when you're walking, when you got walking for some reason.
And
Yeah.
it definitely helps to reduce the pain, right? Because I'm also
Yeah.
having the same issue with you, like my back is paining like so serious, but when I wear this Aulora pants, it's definitely heal, like disappear, like I don't know whether
Like
I still
magic.
have the yeah like magic,
No,
yes.
they are amazing. I have to be honest, I was very skeptical when I saw them in my group, and I remember commenting, what, like, and I'm messaging you like, what is this, you know, this looks like tights, like what. um but yeah, as soon as I put them on, I was like, wow, they're so tight, they support you so much, but they're they're comfortable still, you know.
Yes,
And
yes.
they are quite magical, really. I mean, I didn't expect or believe from looking, you know, at the pictures that it would do as much as it does. Definitely not. Yeah.
Yeah,
I wish
all right.
I could get more out of it if I didn't have the rods in.
Yeah. Okay, what is your advice to anyone out there that struggling having the same pain with you? Did you recommend them to have and to try on the Allura pants?
Yeah, definitely. I recommend them to anyone. You know, my dad's had a hip replacement, my mum had a knee replacement. I bought some for my other half. He gets sciatica, pain in his hip.
Yeah.
So I would personally, I would recommend them to anyone who's got either joint pain or like soft tissue injury, you know, or damage, like from any injury or surgery, or definitely, yeah. I'm the type of person, because I'm a therapist, who wants to encourage everyone to do everything they can for their health, you know. But some people are not so interested as me.
Yeah,
In
yeah, yeah,
especially
yeah.
maybe in this country, people are very skeptical as well about alternative therapies and things. Maybe, like, I don't really know, but yeah, I think that my dad should buy them, definitely. But
Yes.
he just can't be bothered. He just thinks, I'm fine as I am. I just struggle get through. I go out walking a lot. I think it's just, I don't understand. A lot of people I know, they don't want to do things to help themselves for some reason.
Yeah. Because not everyone like trust this pants. Everyone will have the same uh mind, like skeptical at the beginning, but
Yeah,
when they try it on by themselves, they will feel the huge difference, because
yeah,
we both already experience it. So
yeah,
yeah.
yeah. Yeah, I hope so. I wish to just force my dad to wear them, but I don't know. I don't know why.
Yeah.
He can't be bothered. But yeah, but they definitely they help me a lot.
Yeah. Okay. So to everyone that want to know more details about the Aulora Pants, you may contact us directly. You can contact Sarah. You can contact me. So we will have we are really open to give a open discussion with you, give you more details about the pants and how you can get the pants. We will help you to do so. Okay.
Yeah, definitely.
Okay. Thank you, thank you, Sarah, for your time.
Okay, yeah, thank you.
Okay. All right.
Yeah.
Okay.
Okay,
I'm really happy. I'm really happy to talk to you today.
okay, yeah.
All
Yeah,
right. That's
thank you for introducing me to the pants.
yeah. I am so I am so happy that I can help a person in pain
Oh,
like you. Yeah.
she's
Because I
lovely.
pers
She's a
yeah.
genuine person. I can feel, in your heart, you really want to help people.
Yeah.
Definitely.
Thank you so
Yeah.
much for your time, Sarah.
Okay.
Okay.
All right. Thank you.
Okay. Bye
Okay.
bye.
Bye. Bye.